to the people who need them. And so, this morning, we really appreciate, both of you joining us here. And Lynda, perhaps you can begin maybe giving us a better sense of, some of the history and the efforts that you folks are currently engaged in to help follow through to make sure that those who need the help get it.
I think about 3 or 4 years ago is when we sort of realized and looked at the community of physicians on the Big Island in general, Hilo, Kona, Waimea, that the physicians were aging. Unfortunately, there hadn't been a new influx of younger physicians coming in, partly because of they didn't want to move to the Big Island. There's not as many physicians being trained, but the average physician 4 years ago was 50 or above. And we realized, oh my goodness, what are we going to do about that? And everyone's going to retire, and then there will be no physicians left for the community members in that. And realize, how do we attract people? We can recruit and bring people in from various areas of the country as well as Oahu. There is a residency program there for family medicine. But realize that, if you bring them here, train them here, as we say, train and retain. They get to know the community, they live here, they bring their families, they become neighbors with other people and just really feel like it's a home base, and then they stay. And so we thought, okay, well, let's get back on this residency program track, and this is where the bill came up a couple of years ago for that. And then Dr. Jim Donovan landed on our doorstep in Hilo to sort of bring that to fruition and move it forward. And he's here to explain a little bit more about how that program is set up and how it's going to move forward.
Well, it's interesting. Many of the things that you all have talked about here are true, and one of the things I keep hearing, and it is absolutely the truth, is that people who are trained in rural areas tend to stay in rural areas. And the interesting thing about this state is that we know who practices in rural areas, and we know this nationwide. We know that people who are rural born and raised come back and practice in those rural areas. We know that those people, like Lynda, who have a spouse or a link to that rural area come back and practice here. And we also know that those people who are rurally trained come back and practice here. So this program was always set up as a rural training track, and that is that it would start on the island on the Big Island in Hilo, and potentially could be spread to other neighbor islands and areas in the state once we achieve some success. It was built around the concept of a medical home, and the medical home is something that I think in primary care has always been something that we've striven to provide. We've not always done the best job. It's a new old idea. It's an idea of comprehensive health care. It's an idea of access for patients. It's an idea of using appropriate technologies, including electronic medical records. It's an idea of continuity of care, so that it's an idea of sort of cradle to grave health care. It has to be culturally appropriate, and these are always a link between the educational system and the community.
If I could add something to what Jim just said, I think that we're seeing a lot of national attention on healthcare right now. It's no coincidence that our activities are reflecting, the activity in Washington, and there is going to be a real major overhaul of the healthcare system in the coming years, because it's just become too expensive and too few people have really good access to care. And I'm happy to see that the community health community, the family docs, and our local and rural communities are going to be leaders in this area, because it's kind of like going back to the past, but in the old day when you had your doctor and people knew him or her, and communities and families could trust that person, you got really great health care. And I think that somewhere along the line, America maybe got away from the basics a little bit, but they are good for people. They're good for people's health. They're very cost effective, and that's really the truth about healthcare is you need to trust your family physician, and I think that's where we're coming from with these bills and these initiatives.
Jim, there's a link between this program and the university's John E. Burns School of Medicine, correct? Maybe you could explain some of that, or?
Yeah, I'd love to. This truly is and was always built as an interdisciplinary training program. So the idea here is that we would bring together the local community, the hospital, the educational system through the John Burns School of Medicine, and many other medical disciplines. As you can see on this slide, we will currently include the School of Nursing. We will include, through both their nurse practitioner program on Oahu and through the School of Nursing in Hilo. We will also include the School of Pharmacy, ultimately the School of Social Work, the Department of Psychiatry. So the concept here, as Josh was talking about, is that we're going to try to provide a medical home for these people so that we can deliver many of the services that people need in the same spot. And the other benefit is that from an educational point of view, we get the chance to train learners of all sorts of disciplines in our place.
You know, the thing I like about the model you just described is that you really reach out and bring as many of the entities together to work collectively, yeah, to provide for the needs of the community. And I know you folks have, you know, I guess taken up that cause and tried to lay some groundwork for it, and even have a timetable for it. Could you maybe speak to that?
We do. In order to bring this program to fruition, we need to have an accredited residency. And what that means is that we have to have the practice in place prior to the time that those folks who come off and check out all the boxes so that we can bring residents in can come in and do their thing. So our intent is to bring a second faculty member to the practice on the 1st of April. Subsequently, we're going to hire a third faculty member in the summer, and we hope that we will get our accreditation the following year, so that about a year from now, a little bit longer than that, we will match our first set of residents. At that point, then, we will add 6 residents per year for a total of 18, and ultimately about 4 to 5 faculty members for maybe 22 or 23 doctors, which we can add initially to the Big Island.
And the idea is to, as you mentioned, to serve the entire Big Island. That's the purpose of this program. And so that would include West Hawaii and Kohala, et cetera, Ka'u. But the idea really is to develop a model that can be then used in other areas, yeah? So this is really intended as a statewide program, but we're just kind of focusing on the Big Island for now as kind of that kickoff.
We had to